My name is Flonney Thomas. I'm 59 years old. I come from Malawi, Lilongwe. I have this problem of hip since 2006, where they did the hip replacement. In 2023, the problem started again. So I went to our local hospital in Malawi, where they referred me to Manipal Hospital to get the treatment. After reaching Manipal Hospital, Bangalore, the MPC welcomed us, he showed us what to do. Then we meet the doctor, Sunil. Then the doctor examined me, do the x-rays, the tests, and recommended that I should have to do the operation again.
I first saw Ms. Flonney Thomas, a 59-year-old lady from Lilongwe, Malawi, about 6 weeks back in my outpatient clinic. She complained to me with ongoing right hip pain, which was bothering her for the past 1 year. On examination, she had painful movements of the right hip. There was gross shortening of the right hip of about 1.5 inches or so. So we counseled her that she would need a hip replacement, a revision hip replacement, either a 1 or 2 stage. The surgery was challenging in the sense that there was not much hip bone in the socket side to replace, and so we had to use a cage, which is a specialized construct which takes support on the other host bone. And because of repeated surgeries, we used a dual mobility implant, which is used in revision cases to reduce the hip of dislocation. So after such an extensive surgery, the patient continued to do well, and now she's about 3.5-4 weeks post surgery, and we started partial weight bearing in this case.
After the surgery, now I'm feeling better. I can be able to sit and I can be able to walk slowly. All this is because of the doctors, especially Dr. Sunil.
So these kind of complex revision joint replacements of the hip and knee are routinely done at our center at Manipal Hospitals, Old Airport Road, Bangalore.
And I would recommend, if someone else who have the same problem like this, he shouldn't hesitate to come to Manipal Hospital, Bangalore, Old Airport Road. Thank you so much.